Comfortable.
You don't mind the water?
No, I have a water here
Good.
too.
Okay.
Yeah, so we can both drink our waters. Yeah. So, you have a good day today?
I love work. It was great. It was just I'm just the buzz still from the project meeting.
Good.
It's a really
Yeah.
exciting project, and I can really relate to it. Can I tell you what it is? The project?
Yeah. What is it?
It's a video game, non-violent, which I'm so glad, because I hate work. I hate it if I have to manage a team with one of those.
Right.
And it's for autistic kids for word understanding and I can't think of the word now. Word and comprehension of words and understanding, so that the kid. I know autistic kids have a really hard time word association when they take things so literally, and I'm trying to cross that bridge with visuals and an actual game, which I think will really be great for autistic kids.
Yeah, that sounds pretty interesting.
Yeah,
Yeah.
So I was a pretty excited team today about that. So
Yes, you had a busy day at work.
yeah. So all the aspects of project management, it keeps me going. I love it. I just love it because there's never a dull moment. And I have a good team, good people.
Well, why? Since you like your job so much, I don't understand why you'd ever get depressed. It seems like you could just go to work and feel so much better.
Well, I do at work.
Yeah.
Well, at work, it's because home is so depressing compared to work, I guess. I can't stay at work all day.
Well, maybe you could work a little more.
I already do 50 hours a week.
50?
Yeah,
I guess that is a lot.
It's quite a bit. My marriage isn't holding out too well with that. Even, it's not doing so well as it is because I'm gone so much, and pretty much 10 hours a day. I leave at 7, home at 7, if I'm lucky. Sometimes I bring it home. Try not to.
Yeah, that's a long day.
It's a long day. It's always in my head. But, I just feel my life is just so black and white. My persona at work, I wish I could be who I am at work. It stays with me afterwards. It's kind of this adrenaline and this high and this.
Yeah, you seem like a really happy person. Like right now, when I'm talking to you, you seem really happy. So it's actually hard for me to believe that you get depressed.
Maybe it's my depression is kind of really hidden because I get off on people, so I can kind of like a chameleon. And I get excited, kind of hyped up before I come to therapy too.
Okay.
I get kind of excited. I don't know what that is, but maybe it's drama.
The therapy.
Kind of. Yeah. And I'm not at home. Look at this place. It's beautiful. And going home, I go in the door, and it's comforting to me, but nobody else. And that's where I'm being crucified right now, is at home. And
I just had some lunch before we met. And, I think I've got something in my teeth. So excuse me a second, because I hate it when I have stuff in my teeth, because I don't want you looking at that.
Oh, I wouldn't.
I know.
I probably wouldn't tell you if I saw something, because I can never do that. When somebody has a big thing.
Yeah, I know. Yeah.
Maybe I have one.
Do you want one of these?
Okay.
Yeah, here.
Welcome
to try one.
They're great. I like this. This is fun.
Yeah, just get them at Bartell's.
Stimulants? Oh my God, my mom used those.
Really? Your mom used these?
Yes.
Uh-oh. Is that good, or is that not
good? I don't
know
if it's good or bad. It's just a memory flash. I don't know. It's when she had teeth, of course, at the end. We won't go there. How do I get this off? I don't want to get them all dirty.
It's not hard.
I might get them.
You just kind of put your finger in here like this.
Pull it apart.
Just pull one off, yeah.
I didn't know they made stimulants anymore. I can see.
Yeah, they're great. They're the best.
They kind of splinter a little.
Yeah, you got to watch out for the splinters.
I can remember my mom talking and doing this.
So I hope that I hope you liked your mom, because if you see, if I do it, and then if you didn't like your mom and then I do it, You probably heard
Oh.
them talk about how in therapy, you know,
Oh,
like you
that
might,
transference?
the therapist might be kind of like your
Mom.
parent or something.
Well, you could look like her because you dress really well. I mean, she dressed really stylish, so I could project that on you. The stimulant, I don't think that, see, that wasn't a part of her that she would. I don't know. The stimulant seemed more human. She was such a perfectionist in her image to the world that if I caught her using a stimulant, it was like it was kind of like seeing her, you know, do something really human. And she usually didn't want us to see that, but I think she was okay with this. And she, of course, if she was going to be caught with something between her teeth, oh my God. I mean, you know.
Then what happened?
Oh, she would, I mean, and especially if you told her.
Right.
I said, Mom, you got, I mean, I wouldn't. I'd never tell anyone if they had something in their teeth.
Okay.
Never. I mean, I've done projects where, you know, the person leading just had lunch and then they smile and there's this, you know, it's just awful.
Yeah, I know. That's the worst. I've had that where I go and look in the mirror and I think, oh my gosh, I was just doing that whole session. Nobody said anything to me. I actually had this piece of lettuce in my teeth.
Would you want
It was terrible.
Do you call us patients or clients?
Well, either one, patients, clients, it's all the same, you know.
Okay. Yeah. Would you want a patient to tell you had something in your teeth?
Well, yeah, I would. I would because
really?
Yeah, I don't like to go and look in the mirror and then see it there, you know. After.
Well, maybe if that happens, I'll try to get the courage to tell you.
Yeah, please. Yeah, tell me.
Wow. Well, this is really special. I never expected something like this in therapy. I mean, this is like, wow. I'll keep this.
You're gonna keep that?
I think I want to. Don't worry, I won't. I don't hoard stimulants.
Oh, okay. So you don't think that?
I don't hoard. I don't like that word.
You don't like
here. That somebody said that, and I don't.
Well, but I think you do, Eva. I mean, I think you do hoard.
That's
because that's. I mean, we talked about how you collect all that stuff.
Yeah, but I'm not a hoarder. Look at me. Do I look like a hoarder?
Well, what does a hoarder look like?
Some homeless tramp that smells.
Oh,
that's a hoarder.
Well, no, you're not that. Of course not. But you've got a lot of stuff in your house. I think it sounds like you hoard stuff.
John called me that the other night. Oh my God.
He was probably right, you know. Maybe someone needed to tell you.
Well, I'm here. I get maybe. Yeah.
Yeah, but we'll work on it, you know.
Oh man. Such a stigma. They have a TV show about it.
Right, they do. Yeah, have you ever watched it?
I can't. I mean, it's just filth.
Yeah, it's unbelievable. Those people on that show. Yeah.
Oh, and they can't part with stuff. I mean,
yeah.
I understand that, but I mean, to the point where they're hysterical, and it's just like crap. But it's junk, and it's old and mildewy, and looks like you could slide on it. I mean, I'm neat. I mean, I collect shoes and clothes, beautiful, beautiful clothes. And I do, like...
So you collect really nice things, sounds like, yeah.
I mean, what gave you the impression I was a hoarder? Did I make
well,
you think
I was
that?
reading, and, that we have this book, the DSM-5, Diagnostic and Statistical Manual of Mental Disorders. So after we talked, I went and I was reading it, and I read like the diagnostic criteria, and I thought, wow, that really sounds a lot like Eva. They call it hoarding disorder,
Disorder? Hoarding disorder? Oh my God. Oh, I'm gonna choke.
Yeah, be careful over there. But it's not such a bad thing. It just means that you tend to collect.
What's that?
Oh, excuse me. That's my phone. I've got to get this. I'm sorry.
Maybe I should check mine.
Hello? Yeah. We were going to go. What time do you want to meet tonight for dinner? 7 o'clock? Okay. Do you want to meet at my office? Okay, great. Good. Thanks. I'll see you then. Okay, bye.
I don't have an iPhone.
Yeah, I'm sorry
I'm
about that.
embarrassed
But
I don't have an iPhone.
oh, you don't have an iPhone? What do you have?
It's just, I don't know why. I work at Microsoft and I don't have an iPhone. Of course, iPhone's Apple, so who wants that?
Well, yeah, that's definitely true.
I don't know. I just kind of can't let go of it. I just can't.
It's kind of special phone.
I don't know. Yeah,
Yeah.
it does what it's supposed to. It's enough. And I'm so, of course, they're just harassing me at work to get up to speed because they can get a hold of me on that one. But I just rely on my computer. But that is one thing they're getting kind of annoyed about.
The phone. Mm-hmm. Well, maybe we can work on
Yeah.
you getting a phone. Yeah.
Yeah, I don't, once I have something like that, I don't want to change. But I suppose that's something else. That's not hoarding, is it?
Well, part of hoarding is not being able to let go of things.
Yeah.
Or things taking on a meaning, like you feel bad if you let go of the phone.
Kind of.
Something like that. Yeah.
Things get tied up in memories.
Yeah. But I'm interested in the shoes. You mentioned
the shoes.
Yeah.
Yeah.
You have beautiful shoes.
Oh,
I've been
thanks.
noticing them every time you come in.
Oh,
you
thanks.
always have a different pair of shoes.
Yeah, it's kind of my trademark, and they're always red.
Always red.
Always red shoes. Now I've got a little tag, on my email and stuff. It's got a little pair of red shoes.
Wow.
So it's kind of fun. And at work they give me, they gave me a flower vase that was ceramic red shoes. So it's kind of fun,
So that's kind of
kind of classy.
Yeah.
And so I've been doing this with red shoes. I think every day of my life I wear red shoes, and I have been since I was 17.
Wow. I had one pair of red shoes. They were patent leather, red, and I had them about 10 years ago. And every time I wore them, I got so many compliments. People said, "Oh, I love your shoes."
Because do you think it was because they were red,
I
or
think
were they
so.
high heels?
I think it's because they were red. They weren't really that special, except they were red.
Wow.
So do you get a lot of compliments on your shoes?
I do. And I love red high heels. I'm not really good at wearing them, but if I take them to work, I like to wear my red tennis shoes to work.
Okay.
Take them off, and then of course everybody loves my red tennis shoes when they see me come in.
Yeah, I bet.
And then the high heels,
And then you change. Yeah.
But these are really comfortable for walking. So wedgies, all different kinds. Just depends,
Where do you shop?
Oh, all over. I mean, some really high class stores. This is Les Amis. This is they don't really sell shoes, but that's where I get a lot of my clothes. Anywhere from the Bond to, online, French shops, little boutiques. Especially, I can afford any shoe I want, so I sometimes can really spend a lot. And my husband, John, he doesn't keep the books, so he doesn't.
So he doesn't know.
No, except he sees them eventually.
Yeah, he sees the shoes
eventually in the closet and I'm very covetous of how in that particular collection is a lot of space because I put them in special hangers, with pockets.
Oh
wow! And now they're filling closets, but we have 3 bedrooms with no kids, so.
Got lots of space.
Lots of space, so, and he doesn't hang his clothes in there, but the bedroom's starting to get a little, there's probably about 4 hangers with shoes, those shoe hanger things in our bedroom. So I think he's starting to feel a little bit moved out.
What did you just say?
I think he's feeling moved out.
Moved out. I just lost track for a minute.
Oh,
it's a little bit distracted.
It's all right. I just love it. You're so human.
Oh, thanks.
I always think therapists, are kind of, I can't even imagine them doing anything really human. They always seem so together and just so, you seem really human.
Well, thanks.
I appreciate that.
Nice of you to say that.
Yeah.
It makes me feel better, almost like I want to talk to you.
Oh, wow. Well,
Yeah.
I mean, I really enjoyed the last couple of sessions, and I was feeling that way, and It's good. I can let down my hair. I can stop being so on.
Well, I'm glad that you can do that.
Yeah.
Yeah, that's good.
Because, but then again, I don't know. I don't know what to say.
Well,
Uh,
why don't we just talk about where to go buy shoes? I mean,
Really?
I would like some ideas about that because
you want to talk about where to go buy shoes?
Yeah, I do because
But look at those.
Look at these. These are just
Oh, they're
plain
gorgeous.
black shoes.
Yeah, but they're classic.
But I would love to have something like you wear. Your shoes are
Sometimes
really pretty.
Oh, thanks. You just kind of have to. But those are gorgeous. The shape.
Well, thanks.
Yeah.
Yeah, they're very comfortable, actually.
Well, it's all about the foot. It's all about sculpting the foot. Ballet was my original.
Oh, is that right? Yeah.
I'm just in love with the point shoe and the red shoes, the ballet, and the way the arch of the foot, and see how that does that to your foot. Makes it really.
Yeah, I guess now that you mention it, yeah,
classes up your foot.
Yeah.
You
Yeah,
know?
you're right. It does.
And we don't think of our feet as
I still got the
particularly.
price tag on these
Oh my
shoes.
God.
Wow.
How
Oh my
much?
gosh, that's so embarrassing. Well, I'll have to take
Uh-oh.
care of that. Yeah.
Those are great though. I like those in red.
Oh yeah.
Where did you
red
get
would be
them?
Great. I got them online.
Oh,
Yeah, I do a lot of shopping online.
where? What shop?
Oh, they were Clark's actually.
Clark's.
Clark's.
Okay.
Yeah.
Wow. I'll have to check that out.
But I like shopping on Nordstrom online too.
Mhm.
And,
Nordstrom's good.
I think even Macy's sometimes
Mhm.
has some
Yeah,
good stuff for shoes.
You don't have to go to the really,
Yeah.
Have you ever ordered any shoes from France?
No.
Actually, that reminds me. I saw, what's her name? Mary Stuart Masterson in Paris at a cafe wearing red, super stacked high heels.
Oh my gosh. Wow.
And it was her, I swear.
Wow.
And I honestly went over and talked to her about it.
Well, that's really cool. Yeah.
I wonder if she has a thing for red shoes.
Maybe so. Yeah, maybe she does.
Yeah, so,
Yeah, so maybe it's not that big of a deal to collect red shoes. Maybe a
Well,
lot of people do.
Do you think they do collect
I don't
red
know.
shoes? I think it's pretty classy, but it's not just red shoes that I kind of collect. It's
Got other stuff too.
newspapers and
Yeah.
magazines and clothes. And the newspapers are really important to me, not to let go, but they're big. I can see them in my mind. I close my eyes, I see them. And it is. I have to admit, it's becoming oppressive. And when I go home, it's like night and day. I walk in the door, and it's depressing. Even the atmosphere that I want, that I'm comfortable with, is depressing to me. But I still don't want it to go away because when John has cleaned out
Yeah.
the rooms, he's done that.
Yeah.
And then it's just, I can't bear it, really.
Well, I just think you just need to go to work because
Just go to work?
Seems like when you're at work, you
Mhm.
feel pretty good.
Well, what do you think it's about work that makes me feel so regulated and so normal? I don't think I've hoarded collected anything at work. My desk is really neat.
Well, I don't even know if it matters why. I just think it just
Yeah.
seems to help. When
Yeah,
you're at
but
work,
I
it
have
just
to go
seems
home.
better.
I have to go home. I can't live there.
Well, what if you guys just bought a new house? I don't know. That's a lot to think about. But
Yeah, I don't know. There's so many memories at our house. It's
yeah,
At
well,
most.
yeah, there's
I-
memories.
I know the kids. My one son, he's a high school teacher. He's my middle son, Fred, I think he has his eyes on our house. Because it's got 3
Oh, like
bedrooms.
he'd like to have it someday?
Yeah, I kind of think that's where we're hanging. He's got 2 kids, and I do feel bad that I don't have a bedroom for those kids to sleep in, because I have things collected in each room, and he's mentioned it. But he's the sweetest one of my 3 kids. He's the one that
But they're adults now, right? So they've got their own places and
they
stuff?
do, but it's getting tight with his 2 kids.
Oh, I
2
see.
boys.
I see what you mean.
Pretty.
Have you bought any new things lately, or do you have anything in that bag?
Mm-hmm. Yeah, it's funny because they're so cute, but I always feel kind of ashamed. And I kind of try to hide my stuff when I go home, because he always knows I'm going to have another pair. Yeah, I did. I went to a little boutique, and these I just thought would be so cute for summer. And actually, they were really expensive.
Really cute.
Yeah, and they look like ballet shoes.
They do.
Don't they?
Oh my
Yeah.
gosh, yes, yep.
Um,
Wow, those are really cool.
you like them?
Oh yeah, can I see?
Yeah.
Wow.
I mean, they're very unusual, very well made, and they were
Wow.
unbelievably expensive. I think it's the brand. What, Chuka?
Yeah.
Maybe that's Italian. And I think it's real leather.
Oh
Or
my
is it
gosh.
rubber? I can't tell what it is.
Well, yeah, it's probably leather.
I think it's leather. And
Yeah. What beautiful shoes.
really unusual style, classic.
Mm-hmm.
Um,
Those are really nice. Yeah.
do you think, would you want them?
Would I want them? Oh.
Well, maybe I need to do something like, I mean, do you think, I don't know how I'm going to ever stop buying these shoes.
Well, really, at the therapist, we're not supposed to take gifts, but if it would help you let go of something,
Maybe. I mean,
Yeah.
I feel
I
this.
feel like it'd kind of be part of the therapy.
Maybe part of the therapy. I mean, if you think you'd wear them.
Oh, yeah. I think they're my size. I kind of looked and saw that they were.
Do you think?
Yeah.
Well, I don't know. This is going to be weird, but maybe I should try it.
Well, it might be kind of a first step, and letting go of something.
It might. I mean, okay.
You sure?
Mm-hmm. I'll try it. I mean, I can just
these
pretend
are
I'm
just
giving a
beautiful.
Christmas present
They're
today.
gorgeous.
Well,
Thank
yeah.
you. Yes, thank you so much.
You're welcome.
Yeah, I really appreciate that.
Yeah. Well, I
Yeah.
hope I see them on you. Here.
Well, yeah.
Look, you've
I'll
almost
wear
red bag.
That's right. I'll definitely wear them to a session in the future.
Mm-hmm.
But yeah, thank you. Yeah. That's just great.
One night going home without shoes. I mean, I have shoes.
Yeah, how's it feel?
Weird. It's kind of weird.
Mm-hmm. Well, I'm noticing the time, and
Okay.
I actually have to end a little bit early
Oh,
tonight
okay.
because, I just have something I have to do. So,
Okay.
um,
Okay.
but maybe next time I'll add a few minutes on at the end.
Oh, that'd be
if
good.
That's okay.
Sure.
So, yeah. So
Okay.
we probably should stop.
Okay. Can I
Yeah.
have a Kleenex? Is that okay?
Oh, yeah, sure.
Thanks.
Here you go.
Oh,
Yeah.
thank you. Yeah, no, that's fine.
Yeah, I usually don't end early, but
You got, well, you have a
yeah,
life.
I just need to today.
yeah,
yeah.
you have a life. So, I get it.
Yeah, and thanks for understanding.
Oh, yeah.
And
Okay.
the shoes, thank you so
Yeah.
much for the shoes. Yeah.
Okay, that's a big step. So, that's a big step. So,
Okay,
okay.
so I will see you next week.
Yes, same time.
All right, sounds good.
Okay, enjoy.
Okay,
Okay, bye.